particular, we're going to talk about antifungals, antiparasites, antifungals. In general, the drugs we're talking about are amphotericin, Nystatin, the Azoles, flucytosine, Caspar and Microfungus, terbinafine, and griseofulvin. Now, they all have various mechanisms of action. So we're going to describe each one and, again, the usual things like what sorts of infections we use them for and what kind of adverse reactions are there. We're going to start by talking about amphotericin. Amphotericin in general is used most commonly for systemic mycoses, bad systemic fungal infections. The way it works is that it binds ergosterol and it's able to then punch holes into the membrane of the fungus, allowing, again, osmotic swelling of the cell and then just lysing it that way. It's the drug of choice for mucormycosis. Remember, mucormycosis is very dangerous in people with diabetes. It can be given intrathecally, which means, into the spine, for fungal meningitis. It has very significant toxicity. In particular, it's nephrotoxic, and in so doing, it can decrease erythropoietin, so you have to watch red blood cell formation. It can cause arrhythmias. It can cause anemia, again, because of the fact that it decreases erythropoietin. There can be injection site reactions, which make it very painful for people getting it. Although there is a formulation, meaning liposomal formulation of the drug, it can decrease the toxicity, but one problem is that it's prohibitively expensive. The next drug is Nystatin. Very similar to amphotericin, it's so toxic that you can't really give it for systemic use. So in general, you give it for candida infections, very superficial kind of infections, and very often for people with thrush, what you do is you give it in a swish and spit formulation. The next drugs we're going to talk about are the azoles. The azole drugs inhibit ergosterol synthesis. And what that does is, again, you cannot form the ergosterol, which is required for the cell membrane of these fungal cells. And in general, we give these for systemic infections. They typically are a little bit better tolerated in terms of their side effect profile. And one thing that's really nice about them is that they can cross the blood-brain barrier. So it's good for people with AIDS with various problems going on in the brain. But toxicity does include blocking our hormone synthesis. So it can lead to gynecomastia, and it also causes hepatotoxicity. Next one we're going to talk about is flucytosine. Now, flucytosine is converted in the fungal cell to 5-fluorouracil. Now, 5-fluorouracil should sound familiar to you. It's one of our chemotherapy agents. And therefore, if it's going to be converted in the fungal cell to a chemotherapy agent, then we have to worry about what happens if it gets converted to the chemotherapy agent in our cells. So once again, flucytosine is used for systemic infections, but its toxicity should sound very familiar to you. It basically is the same toxicity of chemotherapy. It includes nausea, vomiting, diarrhea, and bone marrow suppression. Next, we're going to talk about Caspar and Microfungus. They inhibit beta-glucan synthesis, and beta-glucan is necessary for the fungal cell wall. It's given for invasive aspergillosis. It can cause upset stomach, GI problems, and flushing. So, relatively well tolerated. Next, we're going to talk about terbinafine. Terbinafine goes by the trade name Lamisil. It's a topical antifungal. It's really for onychomycosis for the most part. The way it works is it inhibits squalene epoxidase. And squalene accumulates in the fungal cell, which is toxic to this fungus, and then it will kill it that way. In general, it's for dermatophytes and, of course, onychomycosis, as already mentioned. Lastly, we're going to talk about griseofulvin. Griseofulvin is given orally. It also is for very superficial fungal infections, the dermatophytes in particular. The way it works is it disrupts microtubule formation, and therefore it is able to block mitosis. You can't form the mitotic spindle without microtubules. The adverse effects for griseofulvin are that it's teratogenic, it's carcinogenic, and also you have to remember that it does induce CYP enzymes in the liver, so you can get drug-drug interactions that way. Moving on, we're going to talk about the anti-parasitic drugs. We're really only going to highlight a couple of them. We're not going to go over a lot of them. They're not super high yield on the step one, but we're going to mention some of the ones that come up over and over again. So number one, we're going to talk about pyrimethamine and sulfadiazine. So we spoke about sulfadiazine when we spoke about antibacterials, but it does pop up over here also because it is used for protozoal infections. So pyrimethamine and sulfadiazine are both used for protozoal infections. They are antifolate metabolites. We give them for toxoplasmosis and malaria infections. The quinines, which we know that are used for malaria as well, the way they work is they block heme polymerase. And what it does is it leads to toxic hemoglobin byproducts that kill the cell. The bendazoles inhibit glucose uptake and microtubule synthesis in worms. Pirantel is the next one. It paralyzes helminths basically by blocking acetylcholine transmission at the neuromuscular junction in the worm. Ivermectin is similar with a twist. It also paralyzes worms, but what it does is it stimulates GABA transmission. Praziquantel, once again, works in a similar fashion from a different angle. It increases calcium transmission into the cell, causing kind of a spastic paralysis of the worm muscle. So that's all we're going to talk about as far as anti-parasites go. Again, not super duper high yield, but if you can remember those, it's going to go a long way for the odd question or two that you might see.